Our Health Connection segment tonight come from the pool and Kearney Physical Therapy.
That's right, I caught up with Patty Reisinger yesterday afternoon.
And we're ready for another Health Connection segment. This is kind of a unique one as we're at the pool at Good Samaritan Hospital. I'm joined by Kearney Physical Therapy's Patty Reisinger. Patty, what a deal that Kearney Physical Therapy does right here at the pool, right?
You know, we're very lucky in this city to have a pool of this nature. A lot of people on the East Coast are jealous of this type of pool.
Yeah, how is aquatic therapy so unique here with Kearney Physical Therapy?
You know, it's a little different than the land therapy that people are used to. We use the properties of the water to work on the same goals. We work on strength, range of motion, balance, but we use the buoyancy in the water to help take the pressure off your joints. So a lot of times if you can't walk out of the water because of pain, you can get in the water and you might be able to walk a mile in the pool because it unloads you. The buoyancy also kind of helps you move your extremities. So if you have a really heavy arm after surgery, you can use the water to help you lift it up.
It's really something. What's the demographic that we're looking at here? Some of the age of the folks and who uses this?
You know, the community uses as well as we use it for physical therapy, and I've seen patients from 2 years old to 95 years old. So we have a wide range of patients. I see a lot of patients that have a lot of back problems, a lot of knee problems. Because of that buoyancy, it unloads their joints and they can do a lot more in the pool without pain. We also have the warm water, so that really helps with muscle relaxation, spasms. It's just a really nice place to exercise.
What type of health ailments are patients that utilize this with Kearney Physical Therapy? What are they dealing with here, Patty?
A lot of them have had surgery. They may have had back surgery. They've had a total knee replacement. They've had shoulder repairs. So they can start their therapy here where it's not as painful for them, and then they can progress to doing more land therapy, or they can continue to use the pool after their therapy.
I was just going to ask about that. If they're done with Kearney Physical Therapy, well, when they're done, because that will happen.
Eventually.
Eventually, yes, they can continue to use the pool.
Yes, we have several ways. They can join as a member, just like the other community members, or they can buy a pool pass and just use the pool and continue the program that we've set up for them and continue to keep their health.
And specifically, are you here most days then, Patty? You're always at the pool?
I am in the pool more than I'm anywhere else. So yes, you're sometimes 8 hours a day almost in the pool.
Patty Reisinger with Kearney Physical Therapy apparently has the best job in the world, and she's kind enough to join us for Health Connections.
Well, Dave, your job's not too shabby.
I was going to say, don't sell yourself short there, partner.
Yeah.
Well, now wait a minute. You get to go to games every night, it seems.
Sometimes.
Yeah.
Speaking of jobs, some Huskers may be going pro.